doctors have been chosen to be our surgeons of the future. They've read the books, they've learnt the theory, but now the practice is over. As trainee surgeons, they get to operate for real.
It's a little bit overwhelming.
Over their first year, we're following them as they get to grips with real patients. From toes to tonsils, they'll be operating.
It's a little bit nerve-wracking.
And it could be on you.
There's always something in the day that makes you feel like an idiot.
The fear that everyone has is you're actually not cut out to be able to do it.
We'll find out if they have what it takes to become top surgeons. Our trainees have already studied medicine for 7 years. Now, they're on one of the world's best and most competitive surgical training programs.
If you are not good enough, we will fail you.
Out of 2,000 who apply, just over 100 are chosen each year.
Good is not good enough. We're looking at excellence.
Surgeons need to learn on the job, just like plumbers or bricklayers.
Yeah, perfect.
It's all about getting hands-on training.
Now drill.
Just lift up your leg for me.
This episode, we follow 4 of them in busy London hospitals as they struggle to get that experience.
How are you feeling?
There's a lot at stake. If they don't progress, they will fail the end-of-year exams and be asked to leave.
Oh, is that Amy?
25-year-old Essex girl, Anita Mohan, has developed a passion for surgery.
I think there's something I can't quite describe. It just makes me more excited just thinking about going into theatre, getting to do operations, getting to do more than holding a retractor, and I get excited by that. I think it's the blood and guts. It's cool.
She set her heart on becoming a plastic surgeon, one of the most competitive specialities.
I really want to like grab every single learning opportunity, any single sort of operating opportunity. This is what I want to do.
She has to impress her new team at Guy's at St.Thomas's.
Every specialty is competitive, surgery is competitive, so what are you going to do about it?
First up, a finger that's been trapped in a door.
In your hand.
Senior surgeon Mr. Tajero will judge whether Anita can do the precision stitching required in plastic surgery.
I was never squeamish. I was just fascinated. It's like when I was younger and I'd watch The X-Files and it was very gory and my mum was like, oh no, turn that off, why? How can you watch things like that? I thought, oh, it's cool. No, it doesn't bother me in the slightest. Every time I've done plastics, I find it fascinating. It's more delicate and you have to take a bit more care, and also it helps me improve in terms of my movements, my handling. This is a little bit more sort of refined.
So all done. So we're going to put the dressing, and that's it.
But this is a relatively simple wound. The real test will come with more delicate and complex operations.
The more you do, the better you get, and that's the one thing with surgery. It's practice and repetition.
This is how we train. This is the breakfast of surgeons.
It's going to be a long day, so Smitesh Patel is building up his strength.
This is the thing that keeps me going, keeps me awake, and makes sure I can work and operate through the day.
Smitesh was born here at St. Thomas's 26 years ago. Now he's back and has just started in the orthopaedic department fixing broken bones.
Surgery is absolutely the only thing that I want to do, yeah. I don't think anything would stop me, unless somebody told me I was so bad that I'd never make a good surgeon. But that hasn't happened yet so far. All right, Florence, how are you feeling today?
I'm fine.
Today, mother of 11, Florence, is having her
remember me
fractured hip
yesterday, don't
repaired.
Yeah. I was all right one minute and on the floor next.
The NHS carries out 100,000 hip operations every year. It's just the kind of surgery Smitesh needs to learn.
It's a relatively routine procedure, so I know the principles of doing one. It's just a case of being the next in line to actually get down and do one.
But when he gets there, there's quite a crowd.
What we do is, before you do anything further,
His senior surgeon, Mark, begins the operation.
I'm relatively junior to Mark and Jeremy. There's a hierarchy in your training, and rightly so. You know, the further along you are, the more that you'll get to do more complex procedures.
An hour in, and another senior trainee is given his chance. The operation is finishing, but Smitesh has done nothing but watch. His registrar, Nick, has nearly completed his training, so he knows how it feels.
I mean, it's frustrating for him because there's actually been 3 of us here, so he's fallen right to the bottom of the ladder. He's been left not being able to do anything.
It can be pretty frustrating sometimes. I've read about this procedure, I've read about how to do it, and it's time I'd like to have a go at doing it.
Sometimes training means being in the right place at the right time.
We had that the other day. Remember the
To increase his odds, Smitesh will have to make sure he never misses an opportunity to be in theatre. Out of the 110 trainees, Onur Gilleard was one of the very top students.
I think I am very ambitious. I can't imagine not wanting that. I can't imagine just thinking, oh, I'll just do this and just be average. You know, you try your very best to be the very best, and that's always, I think, going to be the aim.
Today, Onor's on the front line at Hammersmith Hospital. He's seeing patients in A&E and having to make critical decisions.
A fair amount of our time is spent doing this. We're not always in theatre, being taught how to operate. You know, you need to, like, being a surgeon isn't just about literally doing the technical operation. You know, patients need to be looked after. I thought the consultant thought it was a UTI.
Onur gets an urgent
Has she still
call.
got the pain? Yeah, I will do. No problem. Cheers, bye. We've got a lady who's pregnant downstairs, which is what I was just bleeped about.
Rachel's had a pain in her side for several days. No one's quite sure what's wrong with her.
How many weeks are you?
15.
Is it tender at all?
Just
Okay.
side.
That's all.
Yeah, no. Yeah.
Very much.
Yeah, that's all.
When I'm pressing down like that.
Yeah, that's
And when I let go,
a little bit of pain, but it goes.
I'll just have a look at your bloods and stuff. And
Thank you.
I mean, I think that she may have appendicitis, but I haven't seen appendicitis in anyone pregnant in my couple of years on the job yet. And because she is pregnant, obviously this is kind of more complicated than it would be if she wasn't.
Onor's instinct is that Rachel has appendicitis. If he's right, she needs an urgent operation. But it's difficult to diagnose, and a general anaesthetic is a serious risk for the baby.
Just terrified. Just I hope everything's okay.
Though Onor's consultant agrees with him, operating could put both mother and baby in serious danger.
The fact that she is 15 weeks pregnant, it's not something that you're going to kind of undertake lightly.
Well, hopefully she's all right and the baby's all right, really.
Onor's judgment is on the line.
She did have appendicitis. The appendix was quite clearly inflamed, taken it out, and now she's better. And, you know, it's a huge relief for her. It's a huge relief for us. The baby's doing fine, so it's a perfect result. So, how are you feeling?
I feel so much better.
Really?
Yeah.
Brilliant. So,
Really
we were
do.
right, is it?
Yeah, definitely.
Your appendix was quite inflamed.
Yeah.
And you just had a scan of the baby?
Yeah, she said the
All
baby's
good?
fine, the heart beating, and it was moving, and nothing's wrong.
The baby.
Thank you so much.
Absolute pleasure, and I'm so happy you're feeling better.
Yeah, bye.
kind of really satisfying when you've seen it, you know, from the beginning to the end. And we saw quite a sick young girl yesterday, really, who was understandably very nervous. And now we see a well, smiling mum-to-be. So, all good.
His advanced diagnosis will be noted by his superiors, but like all the trainees, he has to prove his ability to operate alone by the end of the year. Professor Nigel Stanfield sets a high standard at the school.
This first year for the trainee is a very tough year. We're actually striving all the way for absolute excellence. And that means that if they fall short of that mark, then obviously their whole future career may be in jeopardy.
1 second.
During a recent hip operation, Smitesh didn't get to do anything.
I'm going to need to take your sock off, all right? I'm really sorry, Mr. Birdie.
Now he's really hoping to find cases he can take to theatre. Today he's in luck, as a recent cold snap means there are 4 times the usual number of falls and broken bones.
I was going to see a chap who's got a rather nasty ankle fracture.
My foot twisted and I felt an almighty crunch.
Unfortunately, having had a look at your x-ray, you've fractured both the tibia and the fibula. Ideally, the best course of action to stabilise that joint is for an operation.
I'll let her she is first. Having looked at the x-rays, okay, I can say that she's broken a hip. All right. She's going to need an operation. Okay.
Hip, she broke the hip.
She's broken the hip. You may suffer from...
Both Stephen and Shoryan will be going to theatre tomorrow, but Smitesh will have to wait until the morning to find out if he'll get his chance.
The 2 cases I've seen today are probably things that I would normally do, or like to do. Certainly the things that I know about and read up on, I like to think I know how to do. All of us, the whole reason that we do surgery is to do surgery. So that's the aim. Hopefully tomorrow I shall push my way in to try and do at least one of the procedures.
Every morning at 8 sharp, the emergency orthopaedic team meet to decide who will and who won't get to operate.
Examining her yesterday, she had a shortened externally rotated left leg. It was a closed neurovascularly intact injury. Mild hypertension.
Smitesh must present his 2 cases to the team. He desperately wants to take them to theatre.
Tenderness above the fibular injury as well.
But he's not the only one trying to get experience, and he's way down the pecking order. Will he get his chance?
It's mostly indoors.
Can she leave the house if she has to?
I didn't ask.
Okay, you need to kind of gauge. 71. She a bit worried. No.
After hearing from the trainees, the operations go to someone with more experience.
Place it like that. So you tilt the table, and then you do the lateral side. Get the whole.
Smitesh gets another day on the wards. It isn't the sort of training he needs right now.
It's a bit frustrating. I think today, just because, you know, a couple of things have gone on and I've kind of been lumbered with more work than usual. So that's a bit annoying because I can't even get to theatre to actually find out what's going on or even watch the case. There you go.
Today's been a bad day. Sometimes you have to try and make the opportunities as well, but today it just wasn't going to happen. But hopefully in the future I'll have the opportunity to do those things again.
Anita's up early. Today could be a turning point for her.
Sometimes I'm really sprightly in the morning, and it's usually if the sun's shining, and like today, it might take me forever just to do the simplest of things because my brain hasn't woken up. I generally need to have a coffee before I'm fully functional, so. I just want to check, have you got any pain here?
She set her heart on becoming a plastic surgeon.
Lovely to meet you. Make sure you get your lummies and your ice cream. She will. Because the doctor said so. I love plastic surgery. I love the technical aspects of it. I love the challenges that you face. It's a very long training process, but there's a reason for that, and I think plastic surgeons are very excellent surgeons. I love the way they approach it, and I aspire to be like that, really.
This morning, she's hoping to assist in a complex operation with a top reconstruction surgeon, Mr. Healy.
Got a wound created a few days ago.
Their patient is Jane.
Long as my nose is okay. Yeah. No, I know I'm never going to look beautiful.
Probably do a clean.
She's allergic to the sun and continually develops cancer on her face.
So what we need to do is think, how might we reconstruct that?
Jane's come in for a skin graft to repair her damaged nose. She's had a lifetime of operations.
We spray onto wounds to encourage the graft.
I've had it for 40 odd years, and I've just learned to accept it. There's people worse off than me. Loads of people worse off than me. But, you know, I'll just carry on with it. It's got to be done. There's nothing I can do about it.
Jane's operation is Anita's opportunity to prove herself.
I don't really know what to expect, to be honest. So, because it's all so new and there's a lot going on, it's, you know, all very specialised, so.
In this precision operation, Mr. Healy will be judging Anita's
No, that's fine.
every
I was just saying, are you happy with the noise? It sounds a bit faster now.
Okay, 505 repeat, please.
It's her job to carefully cut Mr. Healy's fine stitches. Every millimetre counts.
It's a very delicate structure then. That's it. Just knocked my dressing off with my skin graft off. See? You just knocked the skin graft off there.
A tiny slip means Anita has upset the new piece of skin.
When you're assisting in surgery,
Yeah.
it's against the rules to knock the surgeon's reconstruction off. You need to learn that at this stage of your career.
I learn this with me. It won't happen.
It's going to be tricky trying
It's
to
a bad mistake for Anita. She cannot afford to make errors if she wants to succeed as a plastic surgeon.
Surgery is pressure, and learning to cope with stress and pressure, it's part of the job.
Smitesh is trying hard to get the chance to do an operation of his own.
Yes, I do. There's site nurse
But
practitioners.
as part of a big surgical team, he's often had to watch while more senior trainees get their chance to operate.
I don't know, sometimes you feel quite thick and you never fully learn everything, and there'll always be something in every day where I'll go home and I'll think, okay, I don't know about that, I need to go and read about it. There's always something in the day that makes you feel like an idiot. To be honest, it wouldn't be a good day if it wasn't.
This evening, all the other trainees have left for the day, and Smith is in charge of the night shift. If anyone comes in for an operation, Smith will definitely get his chance. But it's deathly quiet.
Nights are a bit unpredictable here. Sometimes they can be very busy, sometimes they're not. Who knows, something interesting might actually come in later on.
Smith gets a call.
All right, not to worry. Okay, thanks, that's all right. Okay, bye-bye. False alarm, I'm afraid. Oh well.
Four hours into his shift, Smitesh gets another call.
Great, thanks very much. Thanks, bye-bye. Excellent. Okay, so unfortunately this young chap dislocated his shoulder, so we're going to try and get him into theatre under a general anaesthetic to put the shoulder back in joint. If I'm honest, it's the first time I've actually managed to get to theatre when I've been on nights, so a little bit anxious.
Smitesh has permission to try to pop the shoulder back into place. If he can't do it, he'll have to get someone senior out of bed to help, something he wants to avoid.
Slide. Okay, ready, steady, slide.
Just can't feel it moving at all. Give it a good pull. If you don't almost force yourself upon theatres, it's very easy to get left behind. The more willingness you show, the more competence you show in terms of basic skills, the more you'll be allowed to do. Do you think you can push the head if I give traction up? There you go.
He pops it in first time.
I'm really pleased, actually. That's a good morale boost, and, well, hopefully I can get some sleep now, to be honest, but something to keep me going for a little while. Adrenaline's going a little bit. Nice to know that we've managed to sort of do a case at night without having to call in any senior help. That's always a nice coup.
Handling a dislocation is good, but it's not the big break he needs. Top student Onur correctly diagnosed appendicitis in a pregnant woman. Something even experienced surgeons find difficult.
Okay, thanks a lot. Cheers, bye.
But then medicine runs in his blood. His grandma was one of the first women in Turkey to qualify as a doctor.
As far back as I can remember, I was like tiny, like 5 or 6. These medical books that were kind of in my grandma's house. And she used to say to me, one day they'll be like your books and you'll be a surgeon. That's kind of all that I've sort of known, really. And I don't ever remember thinking that I was going to do anything else.
But Onur knows that staying on top means doing well in theatre too.
My ultimate ambition is to be a consultant surgeon, and it's hard, and it's kind of a long way away.
Is there anything that you would like to ask me at all?
83-year-old Bill has cancer.
All right then. Okay, I'll see you a bit later on.
Well, I'm having a kidney removed, and they're going to do it using keyhole surgery, which is a new one for me. I've had lots of other surgery done, but never keyhole. To put it bluntly, I'm looking forward to it.
Using keyhole surgery means Bill will recover quicker. It's also a chance for Onur to find out if he has the coordination needed for this modern technique. A tiny camera inserted into the patient is the only way the surgeon can see what he's doing.
I'll come and grab the scope then, Onur.
Onur's been given the crucial job of holding the camera. If he gets it wrong, the surgeon won't be able to see what he's cutting.
Good, so that's the kidney there, lower whole of the kidney.
These could be kind of long operations where you do very much have to be concentrating 100% of the time, and you've got to be making sure that the surgeon doing the operation can see what they're doing, and that is kind of totally down to you, so it is kind of big responsibility.
Straighten up the camera a bit, that's it.
Nearly 20% of all operations are now keyhole. It's a skill the trainees have to master.
The fear that everyone has is you're actually not cut out to be able to do it. Might actually not be able to operate very well at all, and that would be the kind of like nightmare scenario that you're asked to leave.
That's good.
Inside the body, the kidney is bagged. It's pulled out of a 5-centimetre opening.
Good. Thank you.
Onur's proved that he's got the hand-eye coordination. That's a key skill in surgery.
Onur has very good skills. I mean, he follows the operation really well, anticipates, knows what he's doing. He was pretty much doing the right thing all the time.
You know, there is that kind of adrenaline pumping, and you want it to all go well. And it is a real kind of team feeling. And when you do operations like this, where it's all of you there, it's like a bonding experience. When things go, perfectly as that has, it's a really enjoyable experience.
All the trainees are constantly watched by their consultants, and every slip or triumph will count towards their end-of-year assessments.
This first year is a very, very tough course.
From the wards to the anatomy class, the trainees have to do well in every aspect of their training.
The trainee who does best is the trainee that elbows in. The trainee that does really well is the trainee that's always available.
Only 1 in 4 of all trainees make it to consultant. There's 5 months left, and they're going to be tough ones.
Hi, my name's Rosie, I'm surgical anaesthetist on call.
27-year-old trainee surgeon Rosie Johns had a tough start. In her first 4 months, she wasn't pushy enough and missed out on operations with senior surgeon Mr. Shree.
Certainly she needs to be a bit more forceful with getting to theatre.
After missing important opportunities, she learned that she had to grab every chance or get left behind. She finally got her big break.
Now, I hope I'm a lot more assertive, and that's something I've probably learnt the hard way in this 4 months, but I've learnt it now, so that's okay.
Today, Rose will need all her newfound confidence. She's starting at King's College Hospital doing mouth, face and jaw surgery.
It is just slow, gradual pressure. See the plungers
a speciality
going down,
she knows absolutely nothing about.
So someone practice on me now.
After a crash course, her first task is to inject her new boss, consultant surgeon Mr. Matthews.
I'm terrified, Rose. I'm terrified. God, what's he going to do to me?
We're going to give you a little injection now, if that's all right, just to numb your teeth up.
She's never stuck a needle in someone's mouth before.
Why don't you try doing my lateral incisor tooth, Rose?
Okay.
You know which one that is, don't you?
Yes. Is that okay there for a minute?
I forgot how bad it tastes. Like you, I'm a dental virgin. Okay, that's all right.
Okay, so I'm just planning where I'm going to put it. I've orientated the needle already. Just under the mucosa. There we go. Is that okay?
That's fine. Excellent. Perfect. Didn't feel that at all.
Ready?
Yeah, very good. Didn't feel that at all.
I was really nervous. Could you not see my hands shaking as I was doing it? I was thinking, oh God, I'm going to stick it right through his lip or in his nose or something. But it was okay.
It's a good start for Rose, but she needs to get out of the classroom and into theatre. Only the real patients will count towards her assessments. During the week, Rose has to stay in London. At the weekend, she gets 2 days at home in Portsmouth.
Who reckons that's all the flour you need for 12 cakes? Surely not. It's quite nice to be a normal person sometimes. I suppose you do miss being at home and coming home to your own kitchen and your own fridge.
It's precious time spent with her fiancé Adam.
It's the little bits of time that you don't get to spend together that we both really miss. Just sitting on the sofa, cuddling up on the sofa and watching a bit of television, having a giggle, doing the shopping together, sharing the things that aren't particularly enjoyable but are much more enjoyable when there's 2 of you there, just to be silly and enjoy each other's company.
In their first year of surgery, our trainees are expected to get into 120 operations. Every operation counts. If they miss out, they will fall behind. Anita made a serious slip in a skin graft operation and had to take some criticism.
I think I've got quite a lot of motivation, enthusiasm. I want to learn and I want to do better, so I don't mind being criticised in the way I do things because it's constructive in order to improve. I'll get there eventually.
But she still wants to get into plastic surgery.
Hi Sam, my name's Dr. Mohan.
She needs more practice. Today, Anita's in hand clinic with her consultant, Mr. Ahmed.
In hand surgery, there's lots of sort of small and they can be quite intricate operations, and I quite like that. Just tell me what happened.
I sliced my hand with a Stanley knife, like a cross from here. It's gone numb, sort of like there.
So where does it feel?
One of their first patients, Sam, needs to have his nerve repaired. It would be an ideal operation for Anita.
With Sam's case, I haven't seen the nerve repairs before.
The sooner it goes to theatre, the better. So Mr. Ahmed starts the operation. It's a great opportunity for Anita, but she has other patients to see first. Will she get to theatre?
Can I have a look?
Anita, it's very important for her to see what exactly the damage and what we talked about it, so she in real life she can see this patient.
And ended up breaking my thumb.
The trainees will be judged on how many operations they attend.
Okay.
Or the joint as well.
But it's a busy day in clinic. By the time she's finished and changed into scrubs, it's too late.
You have to really make a big effort sometimes to try and get yourself into theatre, but sometimes it's just not possible. It's a shame, but unfortunately that's one of the stresses that goes with the jobs.
Anita has missed this chance. The pressure's on to increase her experience in theatre if she's going to be good enough to get a plastics placement next year.
It's really tough as a trainee to get surgical exposure. It's really tough. There's a huge amount of pressure put on them. We've all been through it. We've all done it. It's tough.
Smitesh missed out while more senior trainees got opportunities in theatre. But today, his supervising surgeon, Mr. Nicolaou, thinks Smith has earned his turn.
I hope to be able to do the operation on my own, really, from start to finish. So this is quite a big deal, really.
He'll remove metal pins which held a broken arm together whilst it healed.
A procedure that's often underestimated. It can be the most difficult of operations, more so than putting the stuff in the first place.
There's no real simulator for the way tissues feel when you've got them in under the scalpel, when you've got them under the forceps. And that's only something that you get from doing operations and getting stuck in like this.
This is the first of the wires coming out. Good.
Good shot there. Satisfying.
So,
shot.
He's made it look straightforward and easy, but believe me, I've seen lots of people try and remove these, and things haven't gone as well as you would expect.
I was able to do the whole thing from start to finish, which is fantastic, which is basically the whole aim of becoming a surgeon, isn't it? So it's nice to say that I've sort of moved up another level, if you like, another notch on the training belt, I suppose, yeah.
Smith's finally got valuable operating experience. He's back on track to pass the year.
Very satisfied, yeah, good to do. Can't wait to do the next one.
It's 5:30 in the morning. And I've just woken up and I have to go to work now.
On Monday mornings, Rose has to head back to London. She's getting more training for bigger operations in jaw surgery. But the last time she used these tools, she was putting up a shelf.
We share the DIY in my house, actually. I'm the assistant. It's much easier without the rest of the patient attached to it.
Today, Rose will be involved in a major jaw operation.
Hello, Billy. Hi there, my name's Rose. I'm one
Billy's
of the doctors. I
jaw
work
isn't
with Mr.
normal.
Matthews.
The upper and lower jaw grew at different rates. She needs an operation to fix it.
Nervous. Petrified. I'm just scared of the pain.
It's Rose's chance to use her new skills. She'll have a leading role, screwing the metal plate into the jaw to hold it in the right position.
You're so focused on what you're going to do. You're not thinking about, I'm going to drill into this person's face. You're thinking, right, I'm going to drill a hole and then I'm going to put a tiny little screw in it and I don't want to drop it and I don't want to drill in the wrong place and that kind of thing.
Her consultant starts by breaking Billy's jaw.
Yeah. Right, Rose, up to you.
Okay.
If you want to make it straight in and out. Keep the jaw running.
Good, fantastic.
When I'm at work, I love it. I genuinely have moments when I'm at work and I think, I can't believe I get paid to do this.
The screw goes in the same direction, obviously, as you drill the hole.
And I don't know anyone else who enjoys their job as much as I do. No.
Good, excellent. All the way home.
The operation is a success. It's a valuable experience for Rose.
It was good. I'm a bit sort of achy and I want to drink and I want to get at the loo, but other than that, I'm fine.
Onur did well with a pregnant appendicitis case and in keyhole surgery.
Okay, yeah.
Now, his consultant has made him responsible for the care of a very special patient, both before and after her operation.
Hello, Mrs. Hughes. Hi, my name's Honor. I'm one of the junior doctors. I work with
Yvonne
Mr.
has one of the rarest types of liver cancer, affecting only 2 in every 100,000 people.
Surgery soon, obviously. And you're a nurse, I believe.
I'm a health visitor.
She's having a massive operation which carries a high risk. There are often serious complications.
Let's have a look.
For consultant Mr. Zhao, looking after these critical patients during recovery is an essential part of becoming a surgeon.
It will be very important for Onur to learn this part of medical training because sometimes I personally feel it's far more important than performing surgery itself.
Are you feeling okay?
Yes, I feel fine. Yes, it'd be nice to get it over and done with.
I've met Yvonne now, getting to know her slightly, just even in that brief period, and you start to really appreciate that you're treating a person, not just a disease.
So what we do is, first thing we mobilize the liver, okay?
In a 3-hour operation, the team removed the cancerous left half of Yvonne's liver. Onur gets some more theatre experience, but it's only when this operation finishes that his real work begins.
I'll be one of the first people to see her when she comes to. And yeah, I'm looking forward to telling her the operation went well. And I'm looking forward to, caring for her and her getting better.
Yvonne's recovery does not go as well as Onur had hoped.
I just feel so exhausted today.
An infection sets in, which her tired body has to fight.
Yvonne's, a very dynamic, amazing lady. It does upset you when you see that, part of that has gone. Well, I'd like to think that I treat my patients like I would any member of my family. If it was your grandma, what would you do? Yeah, no matter how kind of busy you are, how tired you are, just always sort of keep that in mind. So hopefully we'll start to see a bit more of a rapid recovery over the next few days. Because she is worn out at the moment.
Onur's done all he can. Now he'll have to wait to see if Yvonne can pull through.
Position evaluation.
The best jobs next year will go to those who do best this year.
We are aiming to provide the United Kingdom with the very best surgeons.
With just weeks to go before their final assessments, every patient has a chance for the trainees to give themselves a competitive edge. Anita's hopes of becoming a plastic surgeon were not when she made a mistake in an operation. That patient, Jane, has come back to see Anita. She's recovering well.
How are you yourself? Fine. She's getting a bit of her life back and she can get out a bit more, and I think being able to do something like that for someone is really special, and I think that's one of the great advantages of surgery.
Now, Anita wants to prove she has learnt enough to do these delicate operations herself. Today, she might get her chance. When she was a baby, 7-year-old Halima was in a fire. She still has a nasty bald patch of scar tissue on the back of her head.
It's a chance for me to do some operating. It's always good to see and learn, but it's more fun for me when I get to actually do things.
Anita's consultant is giving her the chance to remove the scar so that Halima's hair can grow normally again. Miss Timoney will judge Anita's handiwork.
If we can aim to perhaps get rid of that area. At Anita's level, it's important to get her concentrating on the detail of everything she does.
Thank you.
I just go straight across? Yeah, go straight across for now.
You're working to actually fix something. You've got a problem and you're working together to try and fix the problem. And I love seeing that.
Probably you just have to go by feel. Always use the single hook.
Yeah,
like a
just
skin
to
hook.
turn it over.
Yeah, you can hold it. Getting Anita to get the right habits, sort of at this stage, stitching wounds. It means that when she moves on to something a bit more delicate, she won't have any trouble.
It's a landmark for Anita. She's done a good job in a delicate plastics operation.
That was really good. It's very exciting, and it's really good for me when I get to be more involved in the procedure. I hope I've made some progress in the way I handle the instruments now. I'm less sort of shaky and thinking, oh, what am I doing? I just get on with it. So I think I've made that progress.
So she's come a long way. She's very competent to do the essential surgical skills. She just now needs to practice that a lot.
It's a much-needed boost. In just a few weeks, Anita faces her final assessments. Only the best will get a plastics placement next year. After 8 months training, Rose should be tackling bigger operations and getting more experience. Instead, she's packing her bags and leaving London.
I thought quite long and hard over it. I think you can't just live to work all of the time.
She's struggled living apart from her fiancé, Adam.
I've probably learnt the hard way that my personal life is more important to me than I thought it was. But I think this is the right decision for me and for Adam as well, I think.
Rose has decided to train closer to home. She's quitting one of the most renowned surgical schools in the world.
It's got some of the sort of biggest teaching and best teaching hospitals, certainly in the country and possibly in the world as well. And it's difficult to think you won't be part of that anymore.
She's our first trainee to quit the course. Onur has proved himself in theatre. His consultant wants him to get experience caring for patients after their operation.
How are you feeling? Yeah, and everything.
He's been in charge of helping Yvonne recover from a serious liver operation.
I will be out to see you a bit later on, okay?
It's taken 3 weeks.
So we're going to see Yvonne now, and she should be going home today, if all is well. And she's having breakfast and putting on some cream, so good sign. Hello. Good morning.
Good morning, I'm just making myself beautiful.
You look back to your old self, really, like back to, yeah, exactly back to that first day when you came in.
Yes.
It's really good to see.
No, I feel remarkably good.
But it's been an absolute pleasure. She's back, you know, you can see, speaking to her, she feels as good as she did before, and that's, you know, so lovely to see. But
all the best.
You too.
All the best in your career.
Thank you very much.
Onur has been there, you know, at the forefront all the time. You know, he feels like a friend almost.
Hello, good morning.
Good morning, Mr. Jones.
How are you?
His consultant, Mr. Zhao, has been watching him at work.
Onur did extremely well. I think he has a very important role post-operatively. I'm very pleased.
It's another good mark for Onur, who started the year as one of the top students. But this experience has reminded Onur that there's more at stake than personal ambition.
I mean, this is the kind of great part of the job. It really is being able to connect with people, like looking after them, caring for them, when they kind of like desperately need you and when they are unwell, and then seeing that care results in them getting better. And yeah, it's amazing, and that's why I wanted to be a doctor, like let alone be a surgeon. It's why I kind of always wanted to be a doctor.
As the year comes to an end, the trainees face their greatest challenges yet. The operations get bigger and tougher. They make life and death decisions. And when it comes to the final examination, who will pass and who will fail?
I don't know if I'm going to fail or not. There's a lot of people that have failed already.
A little bit nervous.
Come take a seat.
Some of them are failing.